Florida Certified Nursing Assistant CNA Exam Test Updated 2025 Question Study Guide. Question 1. A Foley catheter bag should be kept on the floor, above the bladder, below the bladder, on the lap, below the bladder to prevent backflow/infection. Question 2. Where is the radial pulse located? Neck, ankle, thumb side of wrist, inner elbow. Radial is at the wrist. Question 3. How should you identify a resident? Ask their roommate. Check their room number. Check their ID band. Call them by name. ID band is the standard identifier. Question 4. A resident is angry and shouting. You should shout back. Leave the room. Stay calm and listen. Call security immediately. Therapeutic communication involves staying calm. Question 5. When a resident is on NPO status, they can have water only, ice chips only, nothing by mouth, clear liquids. NPO means nothing by mouth. Question 6. When dressing a resident with weakness on one side, dress weak side first. Dress strong side first. Dress both at once. It doesn't matter. Dress weak, dull, undress strong. Question 7. Which position is best for a resident having trouble breathing? Prone, supine, Fowler's, Sims. Fowler's, upright aids lung expansion. Question 8. A resident is choking and cannot speak. What should you do? Wait for help. Perform abdominal thrusts. Offer water. Hit their back. Abdominal thrusts, Heimlich, for complete obstruction. Question 9. Standard precautions should be used for only HIV patients, all patients, only MRSA patients, patients with coughs. Standard precautions apply to all patients regardless of diagnosis. Question 10. What is a living will? A bank account. Legal document about end-of-life care. A birth certificate. A list of belongings. Advance directive for medical wishes. Question 11. Postmortem care is for before surgery, after death, after birth, during sleep. Care given to a body after death. Question 12. What is the normal oral temperature? 96.6 F. 98.6 F, 100.2 F, 97.0 F. 98.6 F is average. Question 13. What is the golden rule of charting? Only chart at the end of shift. If it wasn't charted, it wasn't done. Use pencil. Include your opinions. Legal documentation standard. Question 14. Which of these is subjective data? Blood pressure, weight, resident's report of pain, pulse. Subjective is what the resident says. Question 15. What is the best way to prevent the spread of infection? Wearing gloves. Wearing a mask. Hand washing. Using antibiotics. Hand washing is the #1 way to prevent infection spread. Question 16. The normal adult pulse rate is 40 to 60 bpm, 60 to 100 bpm, 100 to 120 bpm, 50 to 90 bpm. 60 to 100 bpm is the normal range. Question 17. A resident wants to complain about care. You should tell them to be quiet. Inform the nurse or ombudsman. Ignore them. Tell them they are wrong. Residents have a right to voice grievances. Question 18. What is the first step when discovering a fire? Rescue residents. Activate alarm. Contain fire. Extinguish. Race protocol starts with rescue. Question 19. A resident is in isolation. What is done with their linens? Double bag them. Wash in the sink. Throw them away. Shake them out. Double bagging or special handling per facility policy. Question 20. Which of these is a sign of skin breakdown? Redness that doesn't go away. Tan skin. Dry skin. Freckles. Non-blanchable erythema is a stage 1 pressure injury sign.